people, somewhere, they've just forgotten thin line between to look good and to feel good.
It's really important to remember that there is absolutely a role for cosmetic procedures.
If people want looks that matches, they can do anything for it.
Unfortunately, social media, which is really just an algorithm for marketing, it manipulates people a lot. I'm not going to change my ethics based on that. And I think that's what sets me apart from
Truly, because your values plays a very important role in your professional life.
But probably the biggest myth that people come with is that I'm going to look weird. If your injector looks weird, you're probably going to look weird too. We want you to look like the best version of yourself.
Exactly.
We don't like someone else. And if someone's going to give me a photo and say, I want to look like a completely different person, then I'm going to have to talk to them about where does that come from?
Aging is something we cannot stop, but aging gracefully is in our hands. Hey everyone, welcome back to Beautiful Chords, the space where real stories meet real transformations. I'm your host Himani, and today I'm joined by someone truly special in the world of aesthetic medicine. With me is Dr. Heather Anderson, founder and director of Allure Cosmetic Medicine, specializing in non-surgical facial rejuvenation and anti-aging solutions that combine advanced science with aesthetic expertise. Alongside her cosmetic practice, she currently works as an emergency doctor with a background in urgent care and orthopedic surgery, bringing a rare depth of medical experience to her aesthetic approach. From lip fillers to microneedling to Botox, what really happens behind that clinic door? What's natural, what's safe, and what's just hype? In this episode, we will break down how these procedures truly work, explore the myths surrounding them, and uncover what you should truly know before considering any treatment. Hello, Dr. Heather Anderson. Welcome on the show.
Thank you.
We're so happy to have you here.
I'm so happy to be here. I'm honored that you asked me to join.
As much as I'm excited for this conversation to go ahead, I was genuinely excited a night before to meet you outside the studio for a cup of coffee, just to get you know as who you are, the real you, outside these cameras, outside these lights, without the scrubs, just who you are, your authentic self. So thank you for joining us. And we had a great conversation outside.
We did. We talked about all sorts and got matcha in our lips in the process.
For sure.
Always do a check beforehand.
For sure. I've always been fascinated by the cosmetic industry because there's so much that's going on in and around, and social media, which just amplifies everything that you need to know. So many new trends that are coming up. It's hard to follow all of these trends. You don't know which one is right and which one is wrong. So, and I also feel that people somewhere, they've just forgotten a thin line between to look good and to feel good. There's somewhere there, it's just blurring that line altogether in the age that we are living. And people crave for instant gratification.
Oh, absolutely.
And I feel that cosmetic industry packages that desire in such a way, either be it selling it through some chemical drugs or some quick fix serums or whatsoever, they can do that. Because if people want looks that matches, they can do anything for it.
Oh, absolutely. And it's a really great way to make money. So a lot of people in the industry are really just pushing that as well. So unfortunately, social media, which is really just an algorithm for marketing, it manipulates people a lot.
Truly.
And so it's really important to remember that there is absolutely a role for cosmetic procedures, but you have to sort of build yourself from the inside first. And you have to go to someone who's willing to advocate for you and not make you look weird.
Absolutely, for sure. So I'm glad that you're here today because with you, we will debunk a lot of myths that's happening in the skin and the cosmetic industry.
Perfect. And that's what everyone needs to hear because there's just so much noise out there.
Yes. Let's just cut the noise and get straight into it.
Cool.
To begin with, how did you get into this aesthetic medicine procedures? And what made you specialize in skin injectables and the skin aesthetic procedure throughout?
Yeah, so I have an interesting career path in that I like to call it a non-linear career. So when you start out in medicine, it's very much directional. You know, you're primed at an early kind of stage to pick a lane, basically. And when I was in med school, it was like, well, actually, the reason I went into med school was that I was interested in forensic pathology, and then I wanted to do surgery, and then I went into orthopedic surgery and did that for a couple of years, and then I did urgent care because I wanted kids, and I found that was better for lifestyle. It was long hours doing surgery, so I found that for me, I couldn't kind of commit to a family life that I wanted. and then finished my training in urgent care. And then I was sort of just realizing that I was bored. I kind of thought that I would be one of those people that just wanted to be a mum and not really work much. But I kind of realized when my kids started going to kindy and things that I was actually someone who needed to be a bit more productive. So I was at a crossroads and I was trying to seek out more responsibility at my job, which I wasn't getting or I didn't feel like I was getting. And I was trying to figure out what else is there. And I missed the surgical aspects of orthopedics, but I wouldn't be able to go back and do that because of the training is too extensive. So I fell into cosmetic medicine. I was putting feelers out. I was talking to some friends and I kind of really realized that this is a specialty that is actually quite surgical in the sense that it's very procedural, which I miss. And it also combines art, which I used to be really into art, and aesthetics as well, which I'm really interested as well, and then also science. So I looked into what is out there, and then I did my training with the New Zealand Society of Cosmetic Medicine, NZSCM, and I completed my diploma of cosmetic medicine. And then I just started from there, I guess. And it's weird because when I found it, I kind of realized this is me. This is my niche. It is quite a niche sort of specialty, but there's so much more depth to it than what people give it credit for. And I think that's what makes it so interesting, where anatomy, for example, I learned in cosmetic was actually harder than the anatomy I was learning in orthopedics. And that's purely because orthopedics, for example, is approaches to bone. So we're going through a prescribed kind of way of dissecting tissues. And you're seeing the dissections happen down to the areas that you're going to put plates on, for example. But when you're doing cosmetic, it's all kind of imaginary, I guess, is the right way to kind of describe it, where, say, you're doing filler and you're changing structure to someone's face, you're having to think about the tissues that you're replacing. So is it bone? Is it fat? What layer are you putting it in? And you're also having to look at people's faces in a completely different light and say, okay, where is the loss here? How can I make it like highlight their features in a nice way that's flattering, that sort of highlights their identity without changing it?
Exactly.
And then also figuring out, how to avoid the blood vessels, because there's obviously complications you want to avoid, like vascular occlusion.
So it's basically like what? Empowering people, restoring their confidence back in themselves.
Absolutely. And then also just, for me, it's fun. It's sort of, I also work in emergency medicine now as well. And I see people below their baseline in that job. And that's quite a privilege. And I really enjoy helping people. But there is another kind of level of satisfaction you get when you're dealing with people who are above their baseline. So dealing with people who really are so happy to look at themselves in the mirror and feel like their confidence is building. And I try and encourage people to use it as an expression of their authentic selves. So seeing them come into themselves and celebrate who they are, because they usually come to me going, I don't recognize myself in the mirror. I look at myself and I think I'm tired and I'm old and I'm just not the person who I used to be. And that's quite a sad feeling to get, and it usually happens when we're sort of, past 40 and we start noticing that as well. For women, it's around menopause as well. So kind of restoring that confidence in people and just watching them flourish is such a beautiful thing.
When you say you work below the baseline, I feel somewhere on that job, does it make you feel a lot more grounded, that you're happy to be in a position where you are today?
Absolutely. And I think I love working in emergency medicine because the sort of people that work in ED are very humble. You get humbled constantly in ED. Bad things happen. People do have real problems. And we are amongst a health system that is overloaded. It's quite broken.
Absolutely, yeah.
And so you're dealing with a lot of overwhelm, but you're also being able to make changes in people's lives. And I like to take a bit of extra time with people, especially the people who I feel like really need it, like the mental health, for example. That's very much neglected. And, people are trying to access other ways of getting help, like GPs, but GPs are overwhelmed too. And so they end up coming to ED or urgent care, and you kind of feel like you can intervene and help them on a better path, which is actually really, really awesome because, you don't really get an opportunity to do that in any other kind of capacity.
That's wonderful. Working in an ED is surely a very hectic job because you work 10 hours a day, you're on your feet throughout without any breaks and much. I tell you, the last conversation we had on Zoom, I had with you on the Zoom, you actually opened my eyes.
Oh, good. That's what I am to please. Yeah.
Yes.
Yeah.
Because there have been times when I, along with my family, have been waiting in the emergency department at Waitakere or any other hospital for good 6-8 hours, and we haven't got any reply. for me, for in that state, I felt like, what are the doctors doing? Are they taking a long break?
No.
Are they having their coffee breaks?
No. No. And it's such an interesting thing to debunk as well. I think that's so crucial. We are working hard.
Exactly.
I'm run off my feet. No one is sitting around twiddling their thumbs. We don't have capacity for that. And what you see in a waiting room is very different to what's happening behind the scenes.
Exactly.
So there's different parts of the emergency department, and this happens in urgent cares and things as well. No one's sitting around twiddling their thumbs. They are overwhelmed by how many patients are coming in. But it's also triage based on acuity. So if you have a lot of high acuity people who are sick, they need their attention more than, someone who's come in with a snotty nose or a sore throat. And that's not to...
Or even with the fever. That's why I went to the doctor.
Absolutely. And you know what? That's what doctors are here for. We should be able to help you through that. But especially when you feel scared, and it's about educating about what to look for. But I mean, I guess if you're waiting that long, it's a good thing. It means that we're not worried about you. The nurse would have done some obs and kind of figured out that this person is not too concerning, but obviously come back to the reception and tell us if something
I
changes.
did that 6-hour period. The nurse would have come to us twice and thrice, even much more than that.
Perfect.
Right?
Just to check
They are doing their job to the best level. But as patients who are sitting in the ED, just looking for a doctor to come and check them for a fever, or a cough, a cough medicine, that's not something worth.
I know. And it's sort of like, but when you're in an emergency department, you're like, well, you don't need to be in the emergency department for
Go back home.
Again, that's not to say people don't have rights to, to obviously see a doctor. And it is hard. And access to healthcare can be hard. And of course, the public health system is free. So that's sometimes the reason why people access it. But at the same time, it's about understanding that there is a queue of people. I mean, if you suddenly develop central crushing chest pain and collapse on the floor, you're going to go to the front of the queue. So there is a way that you're going to be able to do that. But it's just about understanding there's a lot happening behind the scenes. And I feel quite tired, honestly, physically, mentally, after every shift. I feel energized as well, in the sense that I feel like I've made a difference and I may have learned something or whatever, but ultimately it can be draining, and it can really get to you when you're just doing lots of shifts. That's why I don't think people could do a lot of shifts in a row, because it would really drain you. So we aren't sitting around doing nothing. We are working hard. And I think it's a really important myth to debunk that it's not that at all. And,
for sure.
And I know that there's also been, like stories I've heard of people who are, say, admitted to a hospital waiting for their discharge papers. And, those poor house officers, those junior doctors doing those discharges, they've been running around all day, like probably haven't had a break, and the discharge summaries are probably the last thing they're going to do at the end of the day. So you feel like
admin work as well, apart from the general duties.
Absolutely. So you've got to see patients, then you've got to write your notes. There's so much to it. So yeah, it's certainly not what you think it is. So it's a good thing if you're waiting, because it tells us that you're actually not too bad.
For sure, yeah. My little one, she was born premature. She was born just at the end of 34th week. And she was in the hospital for good 1 month.
Yes.
And I used to go to see her every day and sit there for good 8 hours as well.
Wow.
So I've seen the nurses working bloody hard with the kids. Yes.
So hard.
With the babies, and especially the babies who were like, day 1, day 2, and day 3, checking their blood sugar levels and analyzing everything. Dripping breast milk through the pipes.
And nasogastric tubes. Yeah. It is hard. And that's the thing. It's like actually stopping and seeing how hard people are working.
Yes.
And I think it's just because there's a volume. Like we have this issue with infrastructure, where we have too many people and not enough services to service that. And that's really what it comes down to. There's a bottleneck. And, and you've only got so much staff. And you think about how many patients one person, say one doctor, can see in a shift and deal with acute things and things that require multiple interventions and reviews and things like that. And you're having to calculate how many people are waiting. You do the math. It's, we can't clone ourselves. So it'd be great if we could. But it doesn't work that way. We need more infrastructure, but where's that going to come from?
For sure. So demand is actually higher than the supply at this stage.
Absolutely. And it got harder after COVID as well. So things have changed, and, people want to be seen and fair, but there is just only so many of us. So we do our best. I can promise you that.
No judgment.
Yeah, exactly. But I acknowledge that's frustrating waiting. Yes. I have myself
have waited. That out on Monday's Zoom meeting on
Good.
For sure. Thank you.
Good. Now you'll have some, but more, it's just about having empathy, but also we need to have empathy for patients as well who are experiencing that, and kind of acknowledging that they have waited. I always tell people thank you for waiting. I don't say sorry. I say thank you, because I think it's important to put a positive spin on the consultation, because I genuinely am grateful that you're willing to wait. But I myself have sat in a waiting room with a young kid, to be seen, and it sucks. As a parent particularly, you don't have you don't have any food, you're sore, you forgot your charger and your phone's going to die and your kid's watching, like Cocomelon or something. And you're like, oh, panic. Can we please hurry up and get seen?
You don't know how long do you need to wait.
Exactly. And it's
there's no certainty with this.
Absolutely. So I think Eddie's pretty good in that. They'll be pretty realistic about the wait time. But it is, it's just one of those things, I guess. It's hard, isn't it?
Let's touch base once again about your Allure cosmetic treatments. What misconceptions do people have about getting a cosmetic surgery done?
Well, it's not even surgery, I guess. So when you think about injectables, it's obviously non-surgical. But yes, that's a good distinction to make because when people think of cosmetic, they might think plastic surgery. And that is in the same family. But probably the biggest myth that people come with is that I'm going to look weird, especially when I say recommend filler. Like people will come and see me and go, oh, what can be done? And say they've got some volume loss and I feel like I could change some elements of their face to just highlight things a bit better. Maybe they've lost volume around their cheeks or something where now we're going to change the way the light hits the face and you're going to have this beautiful light that shines into their eyes. It's about working out where the light hits the face and where it should hit the face. And that's kind of how makeup contouring sort of works. But we're trying to recreate that and to kind of educate people around that filler is going to serve you the best in this context. It's actually really hard. And there's been a trend away from fillers, and I understand that because there's a lot of bad filler being done, and I wouldn't want to look like those people either. But when you kind of have to educate people and sort of undo that a little bit, where their expectation is if I have filler, I'm going to look puffy and silly, but going to someone who actually understands what looks good, and there's an element of trust that you have to develop too, that gives the best results for people that have volume loss, for example. But I try and reassure people and say, look, if your injector looks weird, you're probably going to look weird too. So if your injector looks like natural and maybe they've had some filler done or something, then it's kind of reassuring to go, oh, okay, so your taste or your aesthetic kind of endpoint is sensible versus someone who's like, oh, they're looking overdone and is that what I'm going to look like? So it's a vibe as well. It's kind of like anything. You've got to get that rapport and know that you can trust that person. But I think the hardest part is debunking the fact that filler can serve people in an amazing way and you see results straight away.
So basically it's about the subtle enhancements that you do. You cannot change anybody's feature, but you can just alter it in a certain way that makes them feel and look even more beautiful than before they walked into the studio.
Absolutely. Like we're still working with whatever anatomy that they have. So if someone has naturally quite thin lips and you put lip filler in, you can enhance them and make them look more prettier and maybe make the border a bit more sharper and invert them a little bit and so they look, more flattering. But I'm not going to make Angelina Jolie lips happen on someone who has thin lips, and you shouldn't because that doesn't make sense. But it's about respecting the tissues and educating around that, but also then telling people that we want you to look like the best version of yourself.
Exactly.
We don't want you to look like someone else. And if someone's going to give me a photo and say, I want to look like a completely different person, then I'm going to have to talk to them about where does that come from?
Exactly.
There's more going on here than just this because we're not here to change everything. But that said, there might be people who want to masculinize or feminize, people that want to, experiment with different sort of ways that they can present themselves. And that requires just an in-depth discussion to understand the priorities and why they feel that way.
And the best results of the fillers or whatsoever procedures you use are the ones that you can't make a difference.
Absolutely. The ones that you don't really see. So where people are just like, oh, you're looking really good.
Yeah.
Why? That is the
what
perfect.
Have you done?
Have you gone on holiday? Exactly. Well, you just look, younger. And we can't say exactly how young, but we're not going to make someone look 20 again. That's just that ship has sailed. Accept it. But, you're growing into the best version of yourself. And you can still look good with a few lines and a few authentic things about you. In fact, you look more endearing if that happens.
Aging is something we cannot stop, but aging gracefully is in our hands.
Yeah, it is, absolutely. And it's sort of, but there's this judgment about aging gracefully. Like I know that, like my mum's generation, for example, she wouldn't have cosmetic stuff done and she's like, I want to age gracefully. And I get that, but it's sort of that thing about why does it matter how you age versus how someone else's ages? And there's a lot of that guilt involved and a lot of that sort of that pressure that people have, that I have a lot of patients who are very, careful of when they get treatments done because they don't want anyone to know. And I respect that, but it's interesting understanding why people think that way. It's obviously people are worried they're going to be judged. And I've had patients who've had treatments who in all honesty, look fantastic, but they were uncertain about their results for a while and they had to adjust because people around them had to adjust.
Yes.
So, their partner or their mother-in-law or someone might go, you don't look right or you look different, because you've sort of triggered something in them that makes them feel like, why are you changing yourself? But ultimately, it's the person's decision. And if they go to someone who is going to be respectful of their tissues, their anatomy, and their overall appearance, then what's to say they can't do that? But that's changing a cultural norm.
Sure. Forget about the skin injectables and the skin treatment. Even if you get some sort of a makeup done, you come back from a salon getting a makeup done.
And that's accepted.
Exactly. True.
Why is it? You wear nice clothes, you get your hair done, but our face is actually our greatest asset, and we forget that. And people, think, oh, I'm going to spend all this money on an outfit, but they're completely neglecting their face. And even if someone just wants the skin treatments, the skincare, and, they are glowy, they look healthier. And studies have shown that we make actually snap judgments about people just based on the way their skin looks.
All the time.
So people think you're more successful, you have a happy marriage, all these positive connotations just from your skin alone without people even realizing they make that judgment. Yes. But I guess we perceive it as being healthy. So if you look healthier, your skin is healthy, you're glowing, people associate a positive emotion with that. And so there's a lot to that, but it doesn't have to be like all or nothing in that sense. Like that's where my my clinic name came from, All or Nothing, Allure. But it came from that because I see doing things for my patients as an all or nothing thing. You either do it properly, you don't do it at all. But I don't think beauty is an all or nothing thing. It's it's a spectrum of what your priorities are. And I have patients in their 60s, 70s who just want their skin to look better.
Oh, that's awesome.
Yeah, and we're not going to put a whole lot of filler in and iron out all the creases and say we're just going to reverse time. We're going to work with what you have and we're going to celebrate the things that you want to celebrate. I'm not going to try and force something upon you that you don't feel comfortable with, because that's not my job.
Have you ever had a patient at a very tender age coming to you, I want to get my lip fillers done, or I want something else to my face done, like a strong jawline? So have you ever had to deal with patients like this?
Not the strong jawline per se. Lip filler is a big one for sure. But I tend to do more subtle results for lip filler anyway. Thankfully, I haven't encountered anyone who, was unhappy with that and wanted really giant lips, because I would just tell people no. And I have turned people away who say, for example, who have, in my opinion, been overtreated by Botox. They're very heavy, they have no muscle movement, and they're saying, I need more Botox. And you look at them and go, you really don't need any more, because this would be unethical of me to continue to add more. How about we let it wear off for a period of time and then come back and see me? But a lot of people don't like that, because they've had it programmed into them by maybe people they've seen in the past who have been, look, you come back every 3 months, you have the same injections, and they've come to me because maybe I'm locally closer than what the other person was. But at the same time, that's not serving them to do that. And I'm okay to lose a patient based on that, because I think I would rather do the right thing and lose someone than anything else. And I'm a fierce advocate for my patients, and I feel the same way about patients I see in ED. I'm okay to piss off anyone just to make sure that my patients are advocated for. So if someone doesn't want to do their job, I will not change my management plan. True. Same goes if a patient, wants me to do something that I don't think is going to serve them. I'm not going to change my ethics based on that. And I think that's what sets me apart from a lot of people.
Because your values plays a very important role in your professional life.
You want to be treated how other people, you want to treat people how other people treat you.
Truly.
You want to make sure that, you have someone who advocates for you. So I'm just doing a service that I believe everyone should be entitled to.
And that's why we say you have to be your most authentic self when you're presenting yourself.
Absolutely. But it's hard to be like that, because being your authentic self, you are unshielding everything. You're removing your ego, and you're prepared to just highlight.
Just take the mask off from you.
Yes. And guess what? Most people go into cosmetic treatments with a mask on.
Yes.
And they want that mask to get thicker and thicker. And it's like, no, I think there's more to it. There is an element of building self-worth. And, I myself have my own little podcast called the All or Nothing podcast. And my first episode talks about self-worth, because
I'll put that link below in the...
Oh, thank you so much. It's something that it's like I discuss the different shades of cosmetic medicine, but the first episode is particularly something that was really dear to my heart, in the sense that I went through a journey building my own self-worth, and realizing that it doesn't serve me to seek external validation from other people, and that if I learn to love myself and do all those exercises, then you actually can give more kindness to others.
Trust me, Heather, it doesn't come easy.
Oh, it doesn't though.
Yourself, it doesn't come easy. It will come with its own challenges.
Yeah.
And it has been a hard way to learn all of this.
I agree. And I feel like when when you develop that self-love and self-worth and people kind of sense that energy off you, yes, you attract similar energies, which is amazing.
Exactly.
But you also trigger a lot of energies too. And you become a trigger for people that don't like your confidence. They perceive it as arrogance, or they perceive it as something in them that they don't really know, but it triggers something in them. Maybe they're insecure, they have low self-worth, and it shines a light on them that they don't like. So they'd rather villainize you for it. So becoming, in a sense that you love yourself and build self-worth, you have to be okay to be villains in other people's story. And I'm okay with that. I'm myself, and I know what I bring to the table. And I think people just need to learn that. But as you say, it's not an easy journey. It's a process. You can't just snap your fingers. That's why I kind of call it becoming your own religion, because it can still obviously marry with other religions too, but being your own higher power and having faith in who you are, that's really the core. But you don't just turn on a religious belief, just like you don't just turn on a spirituality. You have to grow that faith, and that has to slowly build, and we just need to have faith in ourselves.
For sure, truly.
Yeah, absolutely.
What is a safe lip filler procedure looks like from the first consultation to the aftercare?
Yeah, good question. So lip filler is probably one of the hardest procedures to do from an injector perspective. And it's interesting because it's perceived as such a common procedure. And I have had a patient who told me that they went to, I think, another place ages ago and got lip filler, and it apparently took them only 5 minutes to get it. And I was horrified because I was like, you can't do lip filler in 5 minutes. So basically, when you have lip filler, it shows up everything. So you have to analyze the lips. You've got to make sure that you pick the right filler for it, a soft filler, something that's going to be movable. But also you have to understand the anatomy around the lip. So you've got the pink lip, but you've also got the white lip, which is around the lip. So those are all the structures that are supporting it. So if you have no volume there and you just put filler in the lips, it's going to look like the duck face that no one wants to look like, the Marge Simpson kind of look. So that's not what we're looking for. So you have to really analyze the face, take photos, work out all the angles, and also you've got to take into account chin projection as well. So different ethnicities need the lips to sit on a different lines in order for it to be flattering. So Caucasians, for example, you want the chin to be a little bit more pronounced than the lips, from the line to the nose to the chin. But then you have other ethnicities, such as Asian ethnicities, you want it to sit on the same line. And then so African American or African ethnicities, you want the lips to project a little bit more. So we have to take into account what looks beautiful for different cultures as well. So it's really kind of planning, the tissues around. So is the chin conducive to the lip filler? As the tissues around, is that conducive to the lip filler? And then when you're going to actually do the lip filler, you have to educate people that you're going to look different.
Yes.
And I kind of tell people now that it's a 6-week investment when you have lip filler, because it takes 6 weeks for it to integrate.
For 6 weeks, like the aftercare, or you mean
not really the 6 weeks?
So how many sittings do you do for one lip filler?
So just lip filler is just done in one sitting generally, but it takes 6 weeks for the filler to integrate. That means that you're going to get probably a bit more swollen. One, you're going to look different, and I tell people that, and it sounds really intuitive. Of course I'm going to look different, but I don't think people understand that because it is something that is shown instantly.
You would look intimidated as well.
Yeah, absolutely. So you've got to think, I'm going to look different. And so you have to lean into that and have, again, that trust. It's probably going to be a bit bruised and a bit swollen to start with. And then the swelling might go up a little bit as the tissues settle. And then as it continues to settle over the next few weeks, it will integrate. So the hyaluronic acid integrates into your natural tissues, and then it just becomes nice and, like a beautiful result. So that's why I say it's a 6-week investment, not in terms of recovery. Recovery is pretty quick, actually. It's just about the way that the anatomy and how it settles and when you get your final result. So you have to be prepared to be patient, because I have had patients sort of go, oh, I'm not sure, maybe I should dissolve it before having the 6-week mark come up. And you've got to kind of go, well, actually, let's just give it a bit of time, have a bit of faith. And I tell you, I completely tell you that by the end of it, they've all said, I like it. And some have even said they want more. Yeah. So it's just a thing that you've got to kind of educate. And I think that's the biggest.
It's not an injection. It's actually a full journey from consultation to your aftercare to just educating your patients.
Yes, because if you get, say, filler put in, say your cheekbones, you can see it instantly, but it's deeper and it sort of usually just looks more flattering, whereas lips are different. We are changing the way your lips look for the better, or at least in my opinion, or what I used to do.
Mine also look very different.
Absolutely. And you know what's fascinating? When people get their lips done, their eyes pop. I don't know what that is, but instantly they look more feminine. And so it's a real cool thing where you can sharpen what we call the Cupid's bow, which is that lovely little bit at the top, sharpen it so that it just looks more feminine and beautiful. And then it's also about making sure that you don't make them too wide. There's all these other lines that we look at to make sure that it is flattering on a person's face, so that it
is that what you call an anatomy of your face?
Yeah.
Do you use any software to check it?
It's all done by an eye. I guess, I'm not sure if anyone does use any software, but I know there's a lot of teaching around fillers and things where you can use something called MD codes. Like there's different studies that have gone out to say you can use these codes to plan where to put things, but I like to do it from an artistic perspective where I kind of tell people it's either by painting by stencil versus, like freehand.
Doing a freehand paint.
Yeah, and that takes an eye. And I do think that that's very individual to the different injectors. I think you have to have an eye for it to look good, and you have to see what you think looks good. And you can't just kind of do it prescription like bang, 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 because they might not know, oh, okay, maybe that does look a bit weird. So you have to have an eye for it. It's not as easy as what people think. And I think that's where all the bad stuff comes from, where people are like, oh,
I do have an example to share, but I'll be covering it in the next few questions.
Okay, I'm intrigued. I'll hold fire. Bated breath over here.
What are some of the common mistakes or trends do you see, especially with the lip fillers?
Just too big lips. So lips that don't serve the anatomy of the person. So we're not taking into account all of the surrounding structures, the chin, all that sort of stuff. So, and I guess it's because that's sort of a trend in the sense that they're like, oh yeah, this person has big lips, so I want big lips.
Exactly. They might just look beautiful on me as well.
Absolutely.
How many times any patient has come to you showing you a photograph on Instagram, hey, I want lips like this?
Not that often, actually. It's interesting. I tend to get people who are more wanting to just get my opinion. So that is definitely something that happens. So I have had some people do that. And again, it's just about figuring out what serves them and educating them about that and what looks good. And taking those photos and showing them photos is really powerful too, because when you see those photos as an objective eye, they see, oh, okay, like you wouldn't look good with giant lips or something. But there's lots of fads where, there was this Russian lip technique that came out a while ago, and it was weird because it was sort of putting filler in and then taping it. Tape doesn't do anything. If filler is injected underneath the skin, basically, and the lip, it can't be molded by tape. It doesn't happen. It doesn't work that way.
It's not a wound that needs to be taped.
Exactly. And I think they were trying to tape it to get the shape, but that doesn't work either.
Yeah.
But a lot of these lips were overinflated. And when you get overinflation, there was this whole thing about filler migration. But basically filler can only really migrate when you inject it too deep in the lip, that it actually goes beyond the pink and goes into the white. And then you get this big roll around it, which doesn't look good. So it's sort of educating people about that. I don't know why people think that looks good, because lips can look so beautiful if they're done right. But I guess young people are very easy swayed by social media and things.
Yes.
There's trends that I think back when I was a teenager and I'm like, oh, I probably shouldn't have worn that. And that's just because you just want what other people have when you're young.
Truly. I think social media has just simply pushed the trends into the extreme limit possible.
Absolutely.
And what I feel is the less is more in such a case.
Absolutely. But that's also having an injector who's willing to tell you no.
Exactly.
Because also you got to think about it. A lot of people are in this business to make money. And when they're in it to make money, and it is a business and it needs to be a viable business, it can probably, sway people a little bit. And I think that's part of where the unethical treatments comes from as well. And also not having that confidence as yourself an injector to say, I know what I bring to the table. If you leave my clinic because you're unhappy because I said no, and you want to go and, tell all your friends and say that I'm not a good person, well, I'm okay with that too, because I know what I bring to the table, and my actions speak for themselves. But that takes an element of self-worth and confidence to get to that point where you trust what you bring to the table and you let people be. And if they want to say that and get offended by it, then that's okay. I'm not going to have someone walk around advertising bad work done. It's just something that doesn't sit well with me.
Because word of mouth matters so much in the market.
It does, but also it's about having that conscience. I want to be able to go to sleep and feel okay. Exactly. It's the same thing with ED as well. I'm one of those people that I don't cut corners, so I never leave any stone unturned. I have to feel okay, and I always tell baby doctors, when I work with them, probably one of the best pieces of advice is if you feel uneasy, like you just get that gut feeling, you're like, oh, I'm not 100% sure or happy to send this person home, don't. There's a reason. Ask someone for advice. Listen to that, because inevitably if you continue down that path of ignoring that gut instinct, you're going to have a complication. Something's going to happen and you're not going to be able to forgive yourself for it because you're like, I probably shouldn't have sent that person home. So that kind of plays into the ethics of it as well. And that plays into the ethics of sometimes doctors may ask other doctors for advice and then they feel like uneasy with the advice that they were given. Again, listen to your instincts. Go ask someone else. So there's always other ways of going about it. And if you don't feel right in it, there's a reason for that. Exactly. Listen to it.
Yes.
Don't cut corners.
For sure.
Too many people cut corners and that's how things fall through the cracks. And I've seen it happen time and time again in my career.
All the time.
Yeah. It's sad. And then people suffer. You're dealing with a person.
Exactly.
You're not dealing with a number, a case.
No.
You're not dealing with an arm or a leg. You're dealing with a person attached to that.
Exactly.
And that person comes with a job, a life, everything.
It's just not about one person, but the entire family who's attached to that one
Absolutely.
person. Family, extended family, friends, and so many other people who are just right there looking for them to come back home.
Absolutely. It upsets everything. And it's kind of like, just even for just any doctor say, oh, just go to ED and get that sorted. And you're like, well, that person could have, for example, referred that patient to a particular specialty, but it's sort of, do you understand what it's like for someone to sit at ED? Like exactly as you said, 6 hours plus sitting there, waiting when maybe a discussion could have had with a different person. And so, I understand everyone's pushed and there's always two sides to every story, but ultimately at the end of the day, you're dealing with people. You have to treat people the way you want to be treated. Period. And that just means you might have to work a bit harder, or it means that you might have to piss a few people off along the way, but you're still going to be able to sleep at night and you're still going to be doing the right thing. And it's very rewarding intervening in those situations.
Because the time when you're on your bed and that time when you're thinking about all that has been happened throughout the day, you don't want to sleep with a guilt in your head.
No, you should never feel guilty about what you've done. Absolutely.
Instead of feeling that gratitude for what you have done for all that day, for helping somebody, for leaving an impact on their lives. Instead, you just cannot have a guilt that I should have done this or that for that person.
Absolutely. Because that will just erode at you over time. And if you ignore that, it will fester. It will become the cancer within you. Yes. It's not worth it.
Let's talk a little bit about Botox.
Let's.
For someone new to Botox, what should they realistically expect from their first session?
I guess it depends on the area you're going to have treated. Botox is usually very well tolerated. Obviously, you still have to select your patient right. Like you can't be pregnant or breastfeeding. Obviously, if there's other contraindications, but you've got to be in the right kind of mode for that and the right person to do it. But what to expect is that it's actually pretty well tolerated. It's muscles being paralyzed by a neurotoxin. So we're stopping muscles from moving. And I think one of the biggest misconceptions people have is when they have static lines. So static lines are the lines you have when you're not expressing. So say someone's a frowner, like I've always been a frowner, and when you frown, you make these deep crinkles in your skin. And
for example, on the forehead as well?
Yeah,
absolutely. Or just about these eye wrinkles?
Yeah, see the crow's feet. So if you have wrinkles that have developed over time that are there when you're not expressing, then Botox isn't going to get rid of that. It will help over time.
So it's like once you have a line, it will stay forever?
Not necessarily. So if you're early in the piece and you just have what we call dynamic lines and you're just starting to develop static lines. So dynamic lines are the lines that are there when your muscles are creasing. But then you're developing some static lines because you're aging a little bit, your skin's getting thinner, and that you're noticing the lines are sitting there even when you're not frowning, for example. Of course, Botox is great for that, but it requires repeated treatments and good skincare and maybe some skin treatments in order to help that line disappear over time. But I've encountered this misconception amongst people a lot where they feel like, okay, like maybe I'm 60 something and I've got really deep wrinkles. I've never had Botox before and now I'm getting Botox and now my face is going to be smooth. And you're like, no, it's like, it's like, how you are relaxed right now. This is how it's going to look.
To me.
Yeah, you're still going to look better. It definitely it kind of lifts and people do look more endearing with it, but they will still have some wrinkles. So I think that's a big one to educate people on. And then the actual kind of treatment itself is usually pretty well tolerated. I mean, yes, there's multiple injections, which sounds terrifying, but teeny tiny little needle, and you're done gently, and you can use distraction techniques. You can even use numbing cream. It's very well tolerated. But from my own personal experience, when I first had Botox, it feels weird when it kicks in. So the first, time you start realizing you can't contract certain muscles, you're like, oh, this feels weird. And you kind of have to lean into it and go, okay, let's just let that happen. And then when you get used to it, you miss that feeling when it wears off. So you end up going, oh my God, I'm starting to move again. So it's funny how it works that way, but it does make your skin glow a little bit. And there is some evidence to say it can work on skin, but I don't think there's anything solid. It's really the muscles that we're treating. But it just makes people look lighter and more refreshed. And, you know, when people go, wow, have you been on holiday? And you're like, yes, you have.
I went for a holiday. I came back looking fresh.
Exactly.
Even more energetic.
Absolutely.
Even more beautiful, even though if it's a lot of sunshine, but it still look very gorgeous.
Absolutely. And good Botox is undetectable. So I think that's also a common myth. People are like, am I going to look weird? Well, no, because we're going to just do it in a way that you can still move your eyebrows and you can still express, but it's just smoother. Yeah. And there's a lot of, some of the better videos on Instagram and things are the ones where they do show, you know, the differences between certain people that have had the Botox at certain ages versus not. And you can see how much fresher people look because you're not constantly contracting those muscles. So you're just not creasing the skin quite so much.
What are the spots where you use your Botox injections?
Yeah, so for example, frown and forehead, really, really common. Crow's feet as well. You can do Botox in other areas as well, like lower face and things, and on the neck even. But the most common one is the frown. And I really like that as a starting treatment as well. And that's purely because the frown itself is where our line of gaze goes. And the interesting thing is that the frown is associated with a negative emotion. So when you have Botox to your frown, you stop being able to basically express that negative emotion, and it rewires your brain. There's a part in the brain called the connectome that rewires in response to that, so you feel happier. And because at the end of the day, we're all animals, we mimic each other, we mirror each other's expressions, people around you become happier too.
Wonderful.
So it's really interesting in that it has a massive flow-on effect. And so I think that's a really good starting one. It's great for headaches when people have a lot of tension in the front as well.
I read it somewhere. Is it good for people who've got migraine attacks?
Absolutely. And I see quite a lot of people with migraines who have Botox, and it's extremely effective for that.
Nice.
And it frustrates me that that's not covered under ACC for people that have post-concussion syndrome, and it's not covered by certain health providers like private insurance, for example. And maybe one day we can advocate for that to happen. But essentially, it's extremely effective for migraines. Yeah.
That's great. Let's talk a bit about the collagen bank. It's a buzzword, and the social media is doing a lot wonderful articles on it, the word collagen bank. So I've heard it somewhere that from your 20 to your 30s, your body is making collagen. Your skin is healthier. For sure, we know that. From 30 to 40s, it is using that collagen that you developed in your 20 to 30 decade, and it's using that as a reserve till your late 30s. Then from 40 onwards, the collagen bank that was reserved in your body, it just starts depleting. And that's the time when you should start getting on some collagen tablets. Would you recommend collagen tablets?
Not necessarily. So it's interesting in that there is some evidence to say that the collagen tablets can work for certain people, but there's no strong, hard evidence to say that it works. And the important thing about collagen is that it's made by skin cells, so fibroblasts. Well, it's in all of our tissues, like muscles and things as well.
It's some sort of a protein as well.
Yeah, so collagen is, the collagen in the skin that we're sort of probably talking about is primarily the type 1 collagen, where it is made by the fibroblast cells, and they're like star-shaped cells in the skin. And they use it as scaffolding, and it kind of suspends them, so they're really tight, and that's what makes your skin look tight and thick and plump and all the good things. But with time, it degenerates, and rather than sort of being, this is the decade that this happens and this happens, as a general rule, from the age of 20, you're losing 1% of your collagen every year. And then when you sort of hit menopause as a woman, it declines significantly past that, with people saying 35, 50% of your collagen lost by that time. So collagen banking is a way of stimulating the skin cells. So certain skin treatments, for example, force the skin cells to make more collagen, which gives you that nicer, glowier, tighter kind of look. But the interesting thing is the best, most effective way of getting your collagen in your skin is actually to force the skin cells to make it. So a really good analogy is when you have a house, for example, and you're going to put scaffolding outside the house. If you just throw scaffolding at the house, it's not going to do anything. You need people to assemble it.
Yes.
And so the same goes for the skin. If you just throw some sort of collagen at it, whether you're taking it orally or just putting it on topically on the skin, the skin cells are like, okay, but they're not going to use it. Exactly. So it's not really going to do the effect that what you think. I mean, taking the pills can sometimes strengthen hair and nails and other things as well, and obviously collagen in joints and things. But if you want it for your skin specifically, it's more effective to have a treatment that forces the skin cells to make collagen.
Would you recommend microneedling in that space?
Microneedling is a really, really good treatment.
For the collagen to build up in your...
Absolutely. You have tiny little needles that penetrate the skin, and by doing that, it's controlled damage of the skin. So when the skin regenerates, it makes collagen in the process, and it thickens the skin, and it's a really well-tolerated treatment. It actually stimulates something called tumor growth factor beta 3. I'll say that again. Microneedling is one of those things that stimulates tumor. My God, I'm going to say it wrong. Let's say this again. Microneedling is one of those treatments that stimulates tumor growth factor beta 3, which is basically considered the holy grail of skin healing, and that it heals without scar formation. So it's the only real skin treatment that does that. There are other skin treatments, like when people think of laser, for example, which is ablative laser therapy, where you're basically using a laser to damage the skin and basically shed off the dead skin and reveal new skin. It can look really great, but it actually thins the skin. So you're not having as thick a skin in the end, which means that it's more, I guess, it's more friable in the long term.
Yeah.
So and you can almost look plasticky as a result. Yes. Whereas if you have something like needling, it's a more gentle way. It's not as, I guess, dramatic in terms of the effect, and it's lower downtime as well. If you have an ablative laser treatment, it's going to take a while for it to really settle. It can take months, but from the perspective of microneedling, it's well tolerated as well.
That's wonderful. Let's say supposedly somebody in their late 30s would like to get a microneedling done to look more youthful and younger with a plump skin. How many sessions does that person require?
I usually say at least 2 to 3. If you just do one, it's not enough.
Yeah.
The skin is funny in that you require more than one skin cycle for it to wake up. And that's the frustrating thing about skin treatments, because, we have that instant gratification culture, like, oh my God, I want to look good now. But it is an investment. So it's sort of like the skin has to catch up, do its little turnover, and then around that 4 to 6 week mark, you have another treatment. And then the next 4 to 6 week mark, you have another treatment. And then you can maintain that over time.
And that's how laser treatments as well work.
It can be as well.
Laser treatment.
Yeah, and because again, I guess the tissues can only take so much laser treatment at a time. So any skin thing, think it's an investment. Same goes for skincare too. People want quick fixes, and if you see that, that product on TV on an infomercial that suddenly gets rid of your lines in like 10 minutes, that's obviously not going to be healthy for your skin. It's kind of like eating food that, you have like high GI foods where I feel suddenly great because I'm eating this, high sugary thing, but then you're going to have the crash afterwards and it's not sustainable. So it's an investment, and it's almost like a great analogy for life. It's like a lifestyle. So you've got to think about your skin and think about it as a priority for it to benefit, just like how you think about your body, your mind, your soul. It's not a quick fix.
Well, truly said. Skin being the largest organ of your body, it needs to be given the same care, just like your heart, your liver, and your brain needs.
Absolutely, and it shows everything as well. So everyone in New Zealand has premature skin aging because we have no ozone layer.
Exactly.
And I'm horrified frequently by people who don't use sunscreen. I mean, no judgment. People have their own priorities, but I always try and take the time to educate people about it too, because the sun is made up of not just one type of UV radiation. There's UVB and UVA.
Yes.
UVB is the one that burns you. So that's the one that people are like, oh yeah, I'm going to go out in summer, like on a sunny day like today, and I'm going to put on my sunscreen. Okay, great. And that's because if you don't wear it, you're going to get burnt and go, oh my gosh, that was a bad thing. But if you really think about the other type of radiation, the UVA is the one that kind of goes deeper into the tissues. It's sort of like a cumulative effect, so you don't get the damage straight away, you don't notice it. But if we took a photo of you now or in 30 years' time, with and without using sunscreen, you'll see the difference. You'll get the fine lines, you'll get the solar elastosis, you'll get the skin cancers. And those are horrible. You've got to get them frozen off, cut out, whatever, and hard to treat. And that's a cumulative effect. So a really good analogy is kind of like diabetes. People have diabetes and they don't take their medications because they're like, I don't see the effect. But if you don't take them, you'll end up having dialysis, blindness, amputations, things like that. It's an investment in your health, but you don't see it. Yeah. Same thing with sunscreen. And the key is to find sunscreen that works for you, basically.
Is there any particular sunscreen you would like to recommend here?
Yeah, like the HelioCare sunscreen. HelioCare is a sunscreen I personally stock, and I use it every day. I love it because it has a slight tint to it. It smells like peaches. I'm big on smells. Has to smell good. And it's really light, and it's high sun protection, and it makes your skin look glowy. So it's like win-win-win. Use it instead of foundation. I tell people a lot, don't wear foundation because it seeps into the nooks and crannies and makes you look older. I was one of those people who used to wear a lot of foundation because I have freckles, and I was bullied for my freckles when I was younger. And so you naturally want to cover that up. But with time, and I've had some chemical peels and I use good skincare, I've helped with my pigmentation, but I also am happy to show it through as well, because that's what makes me me. But then you have something like a HelioCare or a tinted sunscreen that you can use instead that still shows some shine and some glow, and that makes you look more endearing than trying to cover it all up.
For sure, because foundation, I believe it has got some sort of a chemical in it which just goes deep, which penetrates deep into your skin in the last tissue. So it's really not a great thing to use, like especially for on an everyday basis.
Yeah, it's going to clog your pores. But really what it comes down to is that it doesn't look good, and it's good to use obviously for an event or whatever, but it just generally people don't look as good. And I'm constantly trying to educate young, beautiful girls and even older people too, because it shows in their wrinkles, because it just makes your skin look matte. People know, and when, guys are like, oh, I wish you didn't wear makeup, to girls, and we all hate that because we're like, well, you want us to look naturally beautiful. That requires quite an investment. But it is...
spend hours and hours doing that perfect makeup.
Absolutely.
You to comment on it.
Absolutely, I know. I mean, gosh, the goal, it's frustrating. But at the same time, there is a principle behind it where it's like, we want you to look naturally beautiful. And if you have good skincare, you want to show the glow. And then everyone kind of just processes it as, wow, you're just glowing today, Himani. This is looking fantastic. So.
Touching base once again on the microneedling and the collagen bank, does it work for all skin types?
Yes, microneedling is good, but we always have to be aware of certain skin types that might have an increased risk of post-inflammatory hyperpigmentation. So Fitzpatrick 3, there's a Fitzpatrick score of looking at skin types. Certain ethnicities have a tendency to have more likelihood of having basically pigmentation to damage. So it's really key to pick the patient well, and also to ask, have they ever had pigmentation from, damage? Like if they've had a scratch or a cut or something and it's gone darker, there's a risk if you damage the skin's going to come back more pigmented in the end.
Okay, that's how it works. Sure. I've got a patient for you.
Oh, good. All right, challenge.
Bring my husband here.
Yes. Well, the interesting thing is from that angle then, and if something like needling would potentially increase that risk, then you could do things like there are certain chemical peels that are good on all Fitzpatrick skin types, and they also act in a similar way. So instead of, that kind of trauma from the needles, you're getting chemicals on the skin that also causes the skin to shed off and bring baby skin to the surface. It's done as a treatment regime as well, similar to microneedling, where you might have a peel every 6 weeks or so for a few peels.
With microneedling, I've got a very funny incident to share with you. So there's this beautician who I go and see every once in 2 months, just for a general face clean or a facial. I see the posters and the certificates being hung on the wall, which says that she's trained in microneedling. And then when I asked her, hey, do you do microneedling? Where did you get the certificates from?
Good question.
Yeah, because when I went to see her, it was just this Sunday, and I knew we were meeting in a couple of days. I wanted to get some more information that we can share on the podcast.
Good idea.
As much as I read about you on your website and I researched enough, I felt like having the first-hand information would make a lot of difference.
For sure.
So I asked her, where did you get the certificate from and how often do you practice? She was like, simple, Himani. I went in for a 1-day course.
Sounds about right. Yeah.
I went in for a 1-day course and I got my certificate from there. I'm like, so you think 1-day course makes a difference? And do you often get patients to do that? She's like, it's quite simple. I only would prick that needle into the top layer of the skin. And then when I talk to you, because we've talked so much about, we have debunked so many myths about the skincare and the beauty industry. When I go back and reflect what I spoke to her and the knowledge that she gave me, it seems there's a vast difference. I mean, you need to educate your customers as well and how to do that treatment. And then in the end, she was like, the facial is done. Do you want some microneedling? I'm like, no, stay away.
Gosh.
I need to go home.
Yes, and that's the thing. I think when people think about needling, because it's not a prescription thing. So for example, Botox is a prescription thing. So doctors have to write a prescription for it. And that's why nurses, for example, who do Botox have to work under a standing order doctor. And so there is a little bit of protection there. But things like needling, unfortunately, they're a little bit free for all. And there's even stuff that people can order online to do their own needling, which is horrifying because it is still a procedure that damages skin and you bleed and you have risk of infection. There's risks of problems as a result.
For me, I felt like, how do you, in just that 1-day course, how do you understand what drug to use for that microneedling? How do you assess everything in just, if you say 1-day course, it's just a 6-hour course, wherein you have experimented on a guinea pig. And that guinea pig is somebody who that instructor brings in.
Yes.
Yeah.
Yeah, and that's the thing. The industry is full of stuff like that, unfortunately. And so it was perfect what you did. Ask questions. Ask where that person, got their qualification from, and kind of see. I mean, from the perspective of myself, having the qualification with NZSEM, I'm accredited. And so people can ask about that, which is good. If you have a doctor that's accredited, because there are also doctors that do it who aren't accredited with NZSEM and they haven't had the formal training. Just because you're a doctor or you're a nurse or you're a beautician, it doesn't automatically make you educated on all these things.
You are not entitled to it.
No. And I've certainly have seen the whole, you get one educational session and that is enough for some people to go and practice. But that's, I couldn't do that.
I get that.
Yeah.
If you say the microneedling or the lip fillers or the Botox cannot be done in one session, how can the education be finished in one session?
It can't be.
And you have the audacity to hang that certificate on the wall and invite your
I know. And there's all sorts of horrible stories. If you don't do, for example, the right sterile technique, not only are you putting at risk, infection and things, but also there were horrifying stories a long time ago, I think in the media, where there was people reusing needles from microneedling, and then your bloodborne infections, there's such risks involved, but they just don't see it. And so definitely patients need to do their research and ask questions and ask really, posing questions. I would encourage people to think of some questions that kind of puts them on the spot if you're unsure about someone who's going to do a treatment, to really gauge, do they understand what they're talking about? Because in my experience, there's a lot of, from patients that have gone other places and come and seen you, for example, the stories that I hear, it feels like people are gaslit into believing that they're the problem. Oh, it's not working because you're the problem. And it's like, well, no, if something's not working or people aren't having a good enough result, there's a reason. How about we troubleshoot that and figure out why that is and understand the science behind it so we can help prevent it in the future or work through it and use it as a learning opportunity. But a lot of people are like, no, I don't want to learn. I know better and it's your problem. And then I get the patients coming to me, and I've had patients come to me say that they've had Botox and it never worked on them. And I was thinking, well, you're either one of the very rare unlucky ones that has proper immunity to it, or something happened that shouldn't have happened. And so we did it and it worked for her.
Yeah.
And she was so stoked. And it was sort of interesting in that, when she went back to whoever she went to, the person just said, oh, well, it doesn't work on you. Just made her feel helpless. And that's not okay, because again, you're dealing with people. It's like, this is a learning opportunity. Complications can happen, unexpected things can happen, but we could work together to get a solution.
Absolutely.
Versus, I don't want to learn, so I'm just going to basically pretend like this doesn't exist and, send you on your way.
Choosing a right practitioner is very important.
Absolutely. And so asking those questions, asking those difficult questions is really important. So you feel empowered and that you can trust them, because you have to feel like they're not going to pull the wool over your eyes. And the same goes for, lots of clinics offer lots of treatments, and it's so confusing because you're like, oh my God, there's so many things. But they have to tailor it to you and tell you why, but not only tailor it to your needs, but also your budget as well. If they're recommending something extremely expensive that you don't really understand is going to help you, then question it. Ask them why, and ask them what their background is and why they seem to have this opinion on things, because I think that's the real big test of whether or not you can trust them. And go with your gut. Ultimately, if someone feels like they're not really knowing what they're doing, I've actually had a patient of mine tell me that yonks ago she went and had microneedling done and they didn't even take her makeup off. And so they needled her makeup into her skin, and that is concerning. And so, you don't ever want to have situations like that happen where, and the poor person is sitting there going, I don't know what to say. I'm sure they should have cleaned my face.
The time when you enter into the clinic door, you would expect that practitioner to know everything about you, to know everything about what they're doing. And for somebody who's not even taken your makeup off and started doing the microneedling, I can imagine what would be the situation from there on.
I know, you're literally, it's so dirty for a start. It's a wonder she didn't get a problem, complication as a result. But it's things like that. And I guess, okay, people can have off days and bad things can happen, but you should have enough training and enough kind of practice that you would catch yourself. Because in medicine, it's all about, this is why it's a Swiss cheese model. When complications happen, it's often because all the holes line up and multiple systems have failed in order to cause a complication. So you should have those checks and things in place if you're going to do any procedure to say, okay, what do I do now? And have it all lined up so you're not going to forget.
Yes.
I have to clean the face first. You know, I have to sterilize things. I have to do it in a certain way that makes it safe, because you're dealing with a person, a human who comes with risks of complications.
I think that's what makes a thin line. That's what draws a thin line between a right practitioner and somebody who's a red flag practitioner.
Absolutely.
Or somebody who has gained knowledge in all these 3 years of working their ass off, and somebody who has just gained knowledge with 1 day course.
I know, and is prepared to put a certificate on the thing. I mean, that's almost embarrassing. I have my certificate saying that I've just had a 1 day course. It's like, and in fact,
Well, as long as it works for them, that's all good in their favor.
Exactly. But it's about educating people, and it's about making sure that you, like, knowing that you have the power. And if you feel like someone's putting pressure on you to do certain treatments you don't feel comfortable with, red flag, like, you know, you can always stop.
And go for it. Yeah.
Absolutely. So it's a trust. It's a real trust. I tell people, I'm your trusted advisor. I will guide you. You're still in the driver's seat, though, and you always should be, because this aging whole process is a journey.
Yeah.
And it can be a beautiful journey. It's sort of, you know, just figuring out along the way what serves you, what doesn't, you know, obviously your needs, your budget, whatever changes over time, and just being able to ride that journey in a way that makes you feel like you can stay true to your authentic self.
For somebody who wants to start their cosmetic journey, what would be some of the subtle ways they can enhance their beauty, their features? Not going way too far, but something very subtle and something very at the basic.
Yeah, that's a good question. First of all, obviously, it depends on the age of the person, how much aging they've had, what their needs are. You know, even if someone is younger, they might have a deficient chin, for example. So therefore, that's where the eye catches. So this is the importance of going and seeing someone for an initial consultation and having a full facial assessment done, because we have to look and identify the areas of need. And it's funny, because when you learn how to analyze faces, you can't help but analyze people's faces. So I'm secretly analyzing faces a lot. But you kind of need to do that because you need to see the deficiencies. But in terms of treatments, start with skincare. Start with sunscreen. So the real basic thing, sunscreen. Start with skincare. Start with sunscreen. So the real basic thing, sunscreen. Really, really good product. You just want to, again, go with something that has evidence behind it. And that actually, you know, people can recommend. So the stuff that I stock,
science.
Yes. And so the stuff that I stock, I use. And so I don't stock a lot of ranges. Like I stock Zero Skincare, Synergy Skincare, and Emapel and HelioCare. That's it. I don't stock other stuff because I don't want too much confusion and noise. I want to only use the stuff that I use and I stand by and I know that it works. Because again, there's a lot of noise on the market. Generally speaking, if you've got skincare that's supermarket brand that's advertised heavily, why do they need to advertise? Does Lamborghini need to advertise? There's a reason for that. So we've got to think about the quality of what's out there and investing that in the right thing.
So what would be that one piece of advice you would like every listener, every viewer to know before going to get any aesthetic treatment done?
I think do your research. It's probably the best advice I can say. Do your research on the person who you're wanting to see.
Yeah.
Look at their website, look at their qualifications, look at the reviews, and I guess just understanding that you have the power to say no and don't feel pressured. So maybe write a bank of questions that you can ask someone to sort of say, hey, you know, what about this? And question them and see what they say. And if they flounder in their answer, then you have your answer. So just make sure you feel comfortable. So know that you are empowered to say no and you're empowered to make good decisions.
It's easy when you throw the ball in somebody else's court and you want that ball to come back. So you know you're in the right direction, you're getting the right answers.
Absolutely. And go with your gut and your intuition and what feels right. So I would just say education is the most important thing, because if you just use Instagram, if you just use the latest fad, if you just, you know, go with the cheapest, then I tell people, if you're going for something really cheap, then you're not paying for a service, you're paying for the product.
Yeah.
So that's a red flag in itself. You may as well just inject it yourself then. Honestly, it's a service. You have to have someone who is prepared to do the right thing by you, but also deal with complications.
And
that's a huge part of it.
A lot of diabetic patients inject themselves on their own.
Yes.
Yeah.
Yes, exactly. And I mean, thankfully, I don't think people can really order stuff online here, but I know overseas people can do that. And it's so horrifying thinking of the complications that can happen. Yes. If you block a blood vessel with filler, for example, you can blind yourself. You can have tissue death. Like there's lots of serious complications that can happen. You need someone who can manage that and educate you about that and follow you up if anything happens. So that is really what you're looking for is the service. So do you feel safe? Think of it like surgery. Are you going to go to a backhanded kind of surgeon and get it done, in someone's dark alley that costs you like nothing? Like when people go overseas to cheaper countries to have surgery,
it's towards doctors.
Yeah, absolutely. And I myself, in my other practice, like in like urgent care in the past, but also in ED, I've seen complications of people having plastic surgery overseas, and it's scary. So I guess, if you want to pay cheap money, you're going to probably get cheap results. So figure just what works for you and just go with someone that you can trust. I think that's the most important thing. Test them.
Wow. Thank you, Dr. Heather, for joining us for today's episode. It was such a warm and fulfilling conversation. This one sort of a conversation I was really looking forward to have, and I was looking for the right person who I can have it with. I'm so glad that I have you on the show. What a pleasure experience it is for me. And not just for me, but I'm sure our viewers, when they listen to it, they will walk away with some great insights. So thank you once again for being here.
Oh, thank you for having me.
Thank you for joining me on this enlightening episode of Beautiful Curves. I hope today's conversation with Dr. Heather Anderson gave you a clearer and a more informed perspective on the world of aesthetic treatments, beyond trends, beyond fear, and grounded in real medical expertise. If this episode brought you value, inspired you, or answered questions you've always had, make sure to follow the podcast and leave a review. It helps us bring more empowering conversations your way. And as always, if you'd like me to answer any questions or topic you would like me to explore in upcoming episodes, feel free to reach out. Your curiosity shapes the space.